Welcome, everyone. Thank you for joining us for the Comparative Study webinar. We performed titer determinations in 46 different adult dogs with 5 different Dutch clinics. These results will be announced today by Dr. Sarah Maurice in a presentation. Dr. Sarah Maurice has been the Director of Molecular Research and Development at Biogal since 2012. She received her PhD in biochemistry and veterinary medicine from the Hebrew University in Jerusalem. Her curriculum also contains different studies in medical science. During the presentation, it's possible to use the Q&A for questions. This is allowed in Dutch language. We will answer these questions afterwards. If we are not able to answer them all in the webinar, you will receive written answer afterwards by email. This webinar will be recorded and will be available at another moment on request. I would like to invite Dr. Sarah Maurice to start her lecture now.
Oops, I opened the wrong one, of course. Okay. There. I have to. Okay. Here, we'll start. I'm really excited to show you the results of a recent study performed relating to in-clinic titer tests. The objective of the study was aimed at comparing 3 commercial in-clinic titer tests that are used in clinics all over the world. The 3 kits were the Canine VacciCheck that's produced by Biogal labs in Israel. In addition, there was Rapid Status Titer Test, which is produced by Biotech Laboratories in the US. And the third one is Fast Test, CPV antibody test, produced by Megacore Israel. The aim of the study was to evaluate the practicality of introducing a point-of-care kit into a clinic. A point-of-care kit means that the clinician can use it easily with limited training and with limited equipment. So we wanted to see if such kits can actually be introduced into the day-to-day practice of a full clinic. In addition, we wanted to test whether different clinics would get different results from these kits, whether regardless of instructions that they received, if they could actually deal with the kits independently and arrive at correct responses and results. We wanted to test specifically the accuracy of these kits. Now, it's difficult to determine the accuracy. Usually we buy a kit, we open up the instruction manual, and somewhere within the instruction manual, the producers will describe what they call the sensitivity and the specificity of the kits, but they rarely actually tell us in comparison to what did they arrive at these values. During this study, the accuracy of the kits that were being tested were compared to what is called a gold standard. A gold standard test is a test that it's performed basically all over the world and has been accepted by many professional forums as the best test that can be formed, that is the most accurate test. And quite often they have inter and intra comparison tests being performed during the year to see that the results are actually comparable from lab to lab. So we chose the gold standard tests being performed at the Animal Health Diagnostic Laboratory in Cornell, USA. So each test, well, we'll describe exactly what's in each test. What I have to mention here is what we actually did calculate at the end was the sensitivity of the kit. What is the sensitivity? The sensitivity relates to the ability of the test to correctly identify the patients or the client that actually has a titer, a positive titer. If he has a titer, the kit should be able to find it. Many tests will give you the results of the specificity of the test. We did not deal with specificity because of the 46 samples tested, none of them were actually negative. None of them were animals that had not been vaccinated, which are what called SPF, that haven't actually been exposed to the disease. In order to calculate an accurate specificity, you have to have a relatively large number of negative animals, which we did not have in the test. Therefore, the results relate only to the sensitivity of the test. Okay, let's see what we have. The three tests, as we said, rapid status, fast test, and VacciCheck. The difference in the technologies. The rapid status and the fast tests are what we call lateral flow devices. They're very simple, they're small cassettes where the sample is introduced to a well or a hole within this cassette. Fluid is added and the sample flows within the cassette and you get 1 line, 2 lines, or some sort of a response which shows you that the sample is positive or negative. It's a very quick, simple test to do. VacciCheck is based on a completely different technology. It's called solid phase ELISA or dot plot. The results that you get with VacciCheck because of this technology are semi-quantitative, which means you can actually follow if the titer is increasing over time. If you take two samples, one at the shortly after vaccination and one later on, you should be able to see the increase in titer. So this technology allows for actually quantifying the antibodies that you're seeing. The structure, as we said, they're cassettes, they're small, I'll show you pictures later of what they look. The rapid status within the cassette has 3 tests within one cassette. It carries the Parvo, Distemper, and Adenovirus. The fast test has Parvo and Distemper, 2 tests per cassette. It does not have, unfortunately, does not have Adenovirus in it. And VacciCheck has actually 12 tests per comb. We don't call it a cassette, it's a comb because it actually does look at a comb, and we'll see pictures later on. And each tooth on the comb has 3 tests. So it has the Parvo, Distemper, and Adenovirus all at one time. And we'll sort of talk about the advantage of this later. The test units, as I described, which diseases, or not diseases, which vaccines, which antibodies they show. Hands-on time actually refers to the time when you put the sample into the set in the test until the time you get the results. Some of these kits have to be refrigerated, and this is not the time where the test has to be warmed up or brought to room temperature is not calculated in the hands-on time. So rapid test and fast test are both 10 minutes. VacciCheck is slightly longer, and this is because it's more accurate and quantitative. To get a good quantitative test, you have to go through certain tests to be assured that the reaction comes to completion. The samples in rapid test, I'm talking about their actually instruction manual. They claim that blood and serum can be used. In fast test, they mention plasma as well as blood and serum, and VacciCheck blood, serum, and plasma. The analysis, how do we see the results? How do we know if there is a titer or there is not a titer? Rapid status is a qualitative result. Actually, the user looks at it visually and he has a line, a control line, and he has to determine if the reaction line is stronger or weaker than the control line. If it's stronger, it's positive. it's weaker, it's negative. This is actually similar in all three kits, except for Fast Test has a handheld mobile reader, which you add to your cell phone. You put the cassette into a slot within this apparatus, and it will give you actually a positive, negative result. So you don't have to question whether it's stronger or not. VacciCheck is also, as we said, it was semi-quantitative. It can have a visual response where the user actually looks at the color and tries to determine whether it's stronger or not. But now they're in the market. There's a comb cam, which you also put the tooth in, and it will give you a number anywhere between 0 to what we call S6 that has been quantitated to the gold standard that we're going to talk about. So we can actually talk about titers when we talk about the values of S1, S2, S3, and so forth. Now, all of these kits, all the manufacturers have declared that that they have tested their kits against gold standards, virus neutralization or serum neutralization, depending on what test it is, or hemagglutination inhibition. They don't, as far as rapid status and fast tests, they don't mention where the tests were done, if they were in-house or they were tested externally. And they don't give us a lot of information on the results, but what they do say is the results give you 99 point something sensitivity, which means close to perfect test. So one of our aims within our study here is to actually physically see what the sensitivity is in a clinical laboratory veterinarian clinic. Okay. What we do know for sure that only VacciCheck has been evaluated, approved by the USDA. It is sold in the United States, and it can be only marketed in the USDA and approval by the USDA. And it has also been approved by MAF, which is similar to the USDA, but in Japan. So it has been well verified. Okay. Not moving. There, up, sorry. Okay. As we said, as it was mentioned at the introduction, the tests were performed at 5 clinics. Each clinic collected anywhere between 7 and 10 samples from their own patients. The test required that the vaccination history of the animal be known and the age of the dog be noted. I just have to mention that the principal investigator in the study was Dr. Tomer Karen, that is not with Biogal at the present, and I have just sort of come in at the tail end and learned the study. And of course, Zohar, our coordinator, sort of watched over what was happening. And these are the clinics. 4 of them were in the Netherlands and 1 in Belgium. Okay, the study design was prospective, which means fresh samples were used. Samples were not collected, frozen, and then tested. They were fresh, which is very similar to what would actually happen in the clinic. They were plasma samples, since the samples were collected in EDTA. So we're talking about plasma. The 5 clinics, as we said, 4 were in the Netherlands and 1 in Belgium, collected 7 between 10 healthy vaccinated animals. The tests were performed sequentially, which means 1 test was performed, completed. Afterwards, the next test was performed with the same sample, followed by the 3rd test with the same sample, with a lag period of maybe 1 to 2 days and not more. So the sample was fresh and was actually in a similar state from kit to kit. The animal's status of vaccination history and age were noted as well. There was a photographic documentation of the results, and we're going to see that soon. Each clinic collected an aliquot of plasma, 500 microliters. They froze them, maintained them frozen until they got instructions of how to send them to Cornell for the gold standard serum neutralization and hemagglutination inhibition test to perform there. So all the tests arrived at the same time and were tested. This is a sample of the pages that the veterinarians were requested to fill out, where you had the samples were numbered 1, 2, whatever. The clinic received a code A, B, C, D, and so forth, so that Cornell would not know from which clinic it came. The age of the dog, the vaccination, and the type of vaccine that he received. So we had full information, the history of the animal. In addition, when the tests were completed and the results were noted on a page, they had the various tests. If it was VacciCheck or rapid status, the results were noted on a page. Any problems were also noted, and these results were afterwards combined to get the final comparative. Well, we saw that the animals, the clients tested were very varied. The median age of all 46 samples was 6 years, but the range was between very young, 1 year to 13 years. And the median time since the last vaccination was 3.7 years, but the range was from 0.3 to 10.2 years. So we had a big range to look at to see how the time affected the vaccination status. Okay. I said we were going to see the kits, and here we're going to see. So the vaccination documentation, by chance, this is from Clinic A. Their samples 1 to 10. This is not moving the way it should. Okay. This is a fast test. This is what I called a cassette. The structure here. The fast test is composed of 2 cassettes. They're actually molded together to form one larger cassette. This is a well where the sample is added. So our plasma is added to here. Following the addition of the plasma, a drop of fluid is added. It runs up a strip. And in the end, there's a window here that will show you 1 stripe or 2 stripe. The first line indicates the test, and the second one, the control line. And the results that I said are based on whether, here in this one, whether the test line is stronger than the control line or weaker than the control line. So these are done visually. And one here is, this is a distemper test, and this is a parvo test. This is a second dog, third dog, fourth dog, and so forth. So there can be a problem if the control line is not strong enough to actually visualize it, and it can happen. These tests can be a bit problematic if you're sensitive. This is the rapid status. The rapid status hasn't molded these cassettes together, but actually has one form. It has 3 tests, the parvo, distemper, and the adenovirus. And here we have the control line and the test line, which is clearer than what we see here. But if we can look, these aren't very good pictures, I have to admit, because they're all cell phone pictures. But what's really outstanding here in the rapid status is the control line is different. Here for the parvo, it's sort of weak. For the distemper, it's weaker, and for adeno, stronger. But if you look at this test, it's weaker. Here, there isn't a control line at all. From the very beginning, it seemed to be a bit problematic to read the results here if you're using a comparative test. Remember, the fast test has a handheld reader, which will help solve the problem if you're not too sure about the control line. But here, it all has to be done visually. Okay, and this is a VacciCheck. The VacciCheck is a comb, as I described. It certainly looks like a comb. Each each tooth here has the 3 tests on it. The bottom is distemper, the middle is parvo, and the top is the adenovirus, and this is a control line and control dot. And we can see the control dots are more or less the same strength. the difference between the way the sample comes out, the dot comes up is a lot dependent on the sample, if it was hemolytic, if there were some sort of clots in it, but generally the colors are very, very strong. As here, there would be a question as to whether the distemper is actually positive or not. Very weakly positive, or here it's even weaker. Now we have the comb cam, which will actually give you the reading for each one of these values. They'll give you a number, which is correlated to and compared to the control dot. Okay, the results. Everybody wants to see the results. So the results were tabulated in an Excel file, which you can't read, but in generally the sample, the age, the last vaccination, the vaccine used, vaccination used, and then the results of the VacciCheck, which is the visual or the comb cam, the rapid status, the fast test, and here's the Cornell's gold standard, the titer and positive and negative. When we tabulated all the results, and we're talking only about the sensitivity, compared to the gold standard. So everything is compared to this gold standard. If Cornell said it was positive, we compared our results and they had to be positive to give you what you call a true positive. True positive relates to all the samples that gave us the same positive results as the Cornell results. True negative means the test kit was negative, as was the Cornell results. False positive would mean that the test kit gave a positive result, but Cornell's result was negative. So that's called a false positive. And a false negative in the same term would mean that the kit that we tested, the point of care kit, the results were negative, but Cornell told us that sample was positive because that is our gold standard. Now I have to just, in between, the gold standard isn't necessarily the best test. There are also problems with gold standards, but this was the way the tests are done. Each sample was repeated once, and we had to depend on what the gold standard results were. We didn't return and do it again. So let's look at these tables. We talk about distemper. It's the same thing, 46 animals for each test. And you have to remember, this is a conglomerate of the results from 5 clinics. So what we have is VacciCheck out of the 46 animals, true positive 45, fast test 45, rapid status was missed, and missed quite a few. Where happened to these positive tests? We'll go false negative, they're here. Okay, so there are a lot of tests that were negative that the gold standard said were positive, that VacciCheck and fast test found them positive. What we have to note here is that in VacciCheck and in fast test, there were false negatives. There were false positives. These tests tested positive in these 2 tests. Rapid status got it right. But on the other hand, negatives were fine with VacciCheck and fast test, but rapid status had 1, a true negative, when we didn't see it. So there were mistakes, but the problems were greater with the rapid status as far as the distemper test goes. If we calculate sensitivities, that how many were truly positive, how many were negative, how many false against the gold standard, we found that the sensitivity for VacciCheck was 100%, for distemper 100%, and for rapid status 58%. Okay, with a confidence index of 95%. So it's a pretty serious test. If we look at the canine parvovirus, here we have again 45 positive, 45 positive, missed. There was a false negative in both of them. In rapid status 36, so it did much better on the canine than it did on the distemper, but there are still 10 false negatives. So if we look at the sensitivity for VacciCheck 97.8, 97.8 for fast test, and for rapid status, 78.3. Definitely better than the distemper. Okay, and if we go further and we look at the adenovirus, we see the same thing happening. We have to remember that the fast test does not have adenovirus, so we can only compare it with a rapid status. Of the 46 samples, the VacciCheck managed to get 43 correct. I had 2 false positive and 1 false negative. The rapid status got 24, which is less than half of them, almost a little, almost half. And then it had 20 false negative. In the final results, the sensitivity of VacciCheck was 97.7, and for rapid status was 54.6. So that is the final comparative results. And here we see it in more pictorial form, which is quite impressive. We see the results CPV, as far as VacciCheck, rapid status, fast test, sensitivity for CDV, 100%, 58, 100, 98, 55. So unfortunately, in the tests that we performed, rapid status did not do very well. That were performed in these clinics. It's not actually us. Okay. Not everything is perfect. There were some inconsistencies. I'm just showing them because nothing is perfect. I'm just showing you here serum neutralization for distemper and virus, adeno, IG titers. Low is the titer is 8 to 32. Medium is 64 to 128, and there's high and very high. So if we look at sample D1, remember I said that there were false positives here in the adenovirus, and VacciCheck gave a response of 4, S4. The highest value you can get is S6. So that's really quite vaccinated. And if we look at it, if you look at the rapid status, it was negative, and the fast status gave a weak positive, but in Cornell, it was negative. So for us, that's a false positive, but if you look at the titer was 8. So it's really on the very, very, very low range. So whether it's below the ability of the kit to detect, or I'm not talking the kit, below the ability of the gold standard to detect, I don't know, but this is definitely very positive. Then we have another here, D10, the same thing happened here. It was negative, the same values. In the VacciCheck, if we're talking about the distemper, there was a false positive here. There's a positive here, I'm sorry, a false positive here, a weak positive for rapid status, a strong positive for fast test. And if we look at Cornell, it was negative, although it did have a titer of 16. So we didn't get too much of an explanation why they called it negative, but fair and fair, we called it a false, these tests a false positive. So if we had repeated that test, maybe the results would have been different. But as is, 98% is very good. Okay, let's summarize this. So fast test, let's look at me. Of all the 46 samples, all were positive for CDV, and 45 samples are positive for CPV. We have to say that a few of them had the control line was not too clear. It was pretty weak. And according to those instructions of fast test, they would be actually considered negative, but we took into consideration that there may have been problems with the test, and from our point of view, they were considered positive. Anyways, VacciCheck, similar 46 samples, 45 samples are positive for CPV, gives 100% agreement with fast test. So the agreement between fast test and VacciCheck was amazing. Both VacciCheck and fast test showed excellent sensitivity compared to the gold standard. CDV 100%, CPV 98%, We can't talk about adenovirus because they didn't have. And if we do talk of VacciCheck on itself, it did identify 43 out of 46 samples correctly. And this test is not available on the FAST test. Some veterinarians think it's not a very serious disease. It doesn't occur that often. But when we're talking about puppy vaccination, it's really important to see that the adenovirus vaccine did take. And there's no getting away with it. Some dogs are immunocompromised, older dogs will lose their titer, and it is important to see, and they will get the adenovirus if they're not protected. And it is a disease that lifts its head every now and again. So it's better safe and having it, checking it anyways. So summary for rapid status. When rapid status results were compared to the gold standard, the sensitivities were 58, 78, and 55% for distemper, Parvo, and Cav. Adenovirus, it's unfortunately that we sort of have a whole slide for rapid status, but it was sort of the bad boy in the test and it just did not perform well. There's no getting away from it. If it was just been in one clinic that it didn't perform well, but in truth, in all 5 clinics, it did not perform well. The performance of the rapid status was relatively low compared to VacciCheck and FAST test, which were comparable. Just FAST test does not have the adenovirus. We have to remember that. So on many of the tests, I tried to show it, even though the picture was not very good in rapid status. The control line wasn't clear. The test line was not clear, which resulted in very difficulty to actually determining what the results were. VacciCheck spots and fast tests were actually easier to interpret. And this is what the veterinarians that use it said. Rapid status has 10 samples, showed positive results for all 3 antigens. Okay, so because we're looking, we're talking about our core vaccines. And 22 samples, this includes the 10 that were positive for the 3. 20 samples were positive for both CDV and CPV, which means 24 cases would be interpreted as requiring revaccination because of negative CDV or CPV. It's a call the veterinarian has to take, that if he sees the adenovirus is positive and the Distemper virus positive, but the parvo is negative, what does he do? And if this is sort of a problem with the kit you're using and it occurs often, it's a really hard decision to make. Revaccinate, try and get only one vaccine. Should I trust the other results? A lot of questions arrive when something like this happened. Interesting thing that we did see that the duration of immunity, and we actually know that from all the articles that have been written, in 13 dogs that had been vaccinated the 3 to 6 years before, they still had good immune status. And 7 dogs that had actually delayed vaccination from 7 to 9 years also were quite well vaccinated. And I have to add, I don't think my little shelter dog hasn't been vaccinated for 10 years, and I titer tested her a year ago, and she's very, very sure it's high titer. So yeah, it should be tested. It's whether you believe in vaccination or not, it's important to know, especially for my little old dog that had distemper, whether I should actually vaccinate her or not. So according to the trial, 70 of the dogs were negative for CPV or CDV or CPV, only on the rapid status. And as I said, if this test was used, a question would arise as to revaccinate or not. It would be a problem trying to decide what to do. So the conclusions, I think, are pretty obvious. VacciCheck and fast tests have, excellent, a very good agreement between themselves. They were actually equivalent in their results to the gold standard also. But again, unfortunately, FastCheck doesn't have the adenovirus. Rapid statistics generated results different from those of VacciCheck and fast tests, and it was really obvious and consistent. And of course, we compared it to the gold standard. It's not as if we could have said maybe they're a better test than the other 2, but compared to the gold standard, they're the weaker of the weakest of the three tests. And of course, as a result of this, if you have a lot of negative tests, it's a problem. You're either going to revaccinate or you don't know whether to revaccinate or not. Now, here's a thing that I've heard often, and I've said it too, and people that do VacciCheck is more complex to operate than fast test. As we saw, it's 23 minutes compared to 10 minutes. So why should I use it? Well, you get added value, which I've repeated probably about 10 times and you're tired of hearing. It has the adenovirus when fast test does not have it. And as I said, some veterinarians dismiss the importance of adenovirus, but it's still recommended by WASAVA guidelines, and this disease is still relevant. There are actually quite new articles coming out of outbreaks of adenovirus. What is important for people that like to log their results and aren't into cell phone pictures, which you can see are not really good, the VacciCheck spots are permanent. You can put it in tape it onto the animal's file, pull it out later for comparison with other tests and so forth. While the fast test, the results become fainter after 20 minutes, and you can't use it retrospectively to go back and look at the results. Did I make a mistake? Has it gone up? Has it gone down? And so forth. So this for certain interested people that actually keep records, it's very, very important. And I said it before and I'll say it again. We've validated it here against Cornell as gold standard, but VacciCheck has been validated and approved by USDA and MAF. And if anyone has actually tried to get approval from USDA, it's like putting your whole body through a little tiny hole. It's test after test after test and repeated tests yearly. It's quite a process. And once you get approval for a kit, it means that it is good and is trusted. This test actually dealt with animals, adult animals. We had one that was younger that were already vaccinated and came to see whether they should be revaccinated or not, or what their status was. But VacciCheck can be used for other things. And I think the most important use for VacciCheck is to determine whether a puppy has responded to vaccination. We all know that maternal antibodies can be an interference if vaccination is started too early, or we're not too sure if the maternal antibodies have decreased enough to allow vaccination to take hold. There are genetic non-responders, either born non-responders or due to disease or old age become non-responders. Antibodies titers can disappear due to certain diseases. So it's good to know what's happening. And we haven't heard this so much from Europe, but from China, there are a lot of faulty vaccines going on. And we know that some people vaccinate their own dogs and buy things online. So it's really important when you have a patient to test to see if he really is vaccinated. And now it goes without saying, a newly adopted dog, if you don't know its vaccination status, even if it comes from some sort of puppy mill and they say it's been vaccinated, it's worthwhile checking it and making sure that it is vaccinated, because a dog with parvo or distemper is a tragedy. It doesn't have to be. There are certain animals that actually develop side effects, immediate or long-term after vaccination. So titer testing, if he's actually has a titer, will prevent the possibility of having some sort of side effect from vaccination. I'm not saying from over-vaccination, from revaccination. And of course, in shelters, it's as soon as an outbreak occurs, titer testing will tell you who to quarantine, who to treat, who to actually not set out for adoption. It can save a lot of time if you titer test in a shelter, as far as what to do with the animals that potentially were exposed to a disease. I will just rapidly go over, because I said the puppy titer tests are really important. And for me, that's sort of the gold standard of VacciCheck or any titer test. Following the initial core vaccine, 16 weeks, that's usually the last vaccination, determine the titer against distemper, adenovirus, and parvovirus at least 4 weeks after the final vaccination, not before that, because it takes time for the titer to arise and take form. If it's positive, you're fine. According to WASAVA, we're talking about WASAVA, they recommend to boost not more than every 3 years. But then again, a lot of articles that come out and say that titer test, if there's a titer, regardless of what a level is, it's a sign that there's memory and you don't have to revaccinate. If the test is negative after he's received all his core vaccines, you have to start thinking, is the animal immunocompetent? Was the vaccine good? Did I give it at the right time? And so forth. Once you come to a conclusion, you say, well, I'm not too sure. Repeat the vaccination. Of course, you have to protect the animal and not have it exposed to other potential animals that are potentially can infect him. Some people say use a different product. For some reason or other, the product that you use may have not taken hold as it should. Repeat the serology the same way as previously. If it's positive, you're safe. If it's negative, you have to sort of determine what the problem is, whether it's innate, if he's a non-responder, and you can more or less determine that he's unprotected and that animal has to be treated quite differently than all the other animals. That's it.
Thank you, Dr. Sarah Maurice, for the presentation.
Thank you.
I would like to invite Dr. Karin and Marijke to join the meeting. Marijke is a veterinarian assistant by Dr. Annemieke Kales. She is using the VacciCheck in the clinic in Uithoorn for many years. Dr. Karin Salomons is working for a very long time at the veterinary clinic in Utrecht, Lunetten. Both are using the VacciCheck for years and also tried the RSTT. Marijke, are you there?
Yes, yes I am.
Okay, I have 3 questions. Is the VacciCheck easily integrated in your clinic? And how user-friendly is the use in practice?
Yes, it was easily to integrate. Right when we started to use the VacciCheck, we started to start the VacciCheck right after we take the blood from the patient. So we take blood and we perform the VacciCheck. We perform the VacciCheck manually, usually by the veterinary assistant. And with the help of a timer app on your mobile phone, you can perform the steps at exactly the right time. A trained assistant can do this just fine. It doesn't need to be done by the veterinarian itself. And when customers make an appointment with us, they know that we perform the test immediately. And they know that they have to wait a little while for we have the results. And it's not a problem. They take a little walk or drink a cup of coffee at our clinic and they wait until we have the results. And since we start using the RoboComp, performing the VacciCheck is even easier. And also reading the results with the CompCam is also more accurate and easier.
Thank you. Thank you. What are the benefits of using VacciCheck in your clinic?
Well, customers come to us especially because we have a lot of experience with the use of the VacciCheck, and especially in puppies and cats. And well, we attract a new group of customers with it, but we can also serve our existing customers in a better way. And it's clear and easy to explain to our customers what we are doing and why we are doing it. And by measuring, well, we can give the appropriate vaccination advice. And in this way, yeah, we can work as appropriately and as possible for each specific patient. So we can make a good plan for each patient.
Thanks. In the clinical significance, it's mentioned that the RSTT test failed to provide consistent, accurate results, which could lead to unnecessary revaccination of dogs. What do you think of this conclusion?
Well, we think it's important that you can rely on the results, and when a dog has a sufficient protection, you do not want to give him unnecessary vaccinations. So yeah, a titer is about being able to vaccinate at the right moment. So yeah, it's good to know that you can rely on the results and that they are correct.
Yeah, okay, thanks.
You're welcome.
I have 3 more questions for Dr. Karen.
Yes, my video is a little bit off, so I don't know why, but he doesn't want to show me.
Okay. Can you explain what are the consequences of a false negative result?
Yes, of course I can. The consequence of a false negative result is that there is still protection, but it seems that if there's no longer any protection against the disease, so in that case we will advise to vaccinate the dog or cat, and the risk, I think there is a risk if there are too many false negatives, then all the people will be disappointed that every time they take a titer test, it will come out negative and they will stop using it because it's double the costs. And every time again, after vaccination, we recommend them for another titer test to see if the vaccination did what we expected to do.
Yeah.
So yes, I think that's the consequence of a false negative.
Okay, thank you. The sensitivity results in the comparative study. It seems that there is a huge difference between the results. What do you think of this?
I think that's a pity because the huge difference in terms of sensitivity resulting in unnecessary vaccinations. With a test with a low sensitivity, there will be more false negatives. In this case, it will result in results that tell you there is no protection and there is. So we have to advise again to vaccinate. And all the tests that me and my colleagues did, we performed right, so there shouldn't be any faults in there. And it's remarkable that all the clinics had the same results. So,
yeah. Okay, thank you. What can you tell us about the way that this comparative study was performed with 46 dogs and 5 vets and the Animal Health Diagnostic Center at Cornell University?
Well, we were all asked to take samples for this comparative study, each with a maximum of 10 adult dogs with a known vaccination history. And we had to take quite a lot of blood because there had to be a couple of tests and the golden standard. And the comparison was performed by doing 3 different titer tests. And yep. After that, the freezing of the plasma, and you came and collected with us and you sent it to another lab to compare it with the golden standard. And well, each clinic performed the 3 tests accurately and communicated the results with text and photos. And the remaining serum was sent to the expert laboratory, and the Cornell University determined the titers according to the golden standard. So a total of 4 tests were performed of the blood of each dog. In this way, the sensitivity could be properly compared. After all the results were compared, it was obvious that the VacciCheck came out as best because of the 3 tests and the best sensitivity, in my opinion.
Yeah, okay, thank you. I would like to thank Dr. Sarah Maurice, Marijke van Dr. Kalis, and Dr. Salomon for the presentation and the participation. Also, thanks for the 5 veterinarians for taking the tests as a basis for the research at Cornell University. Thank you for watching. We will continue to assist you in titer testing. Cats and dogs vaccinated only if measured and necessary is our goal. Okay, tot ziens!